now we are going to hear from Liam Lee and Karl Ege. Yesterday, I was pleased to accompany Caroline and Christy Chen, who delivered more than 2,200 KN95 masks to Chief Scoggins at the Seattle Fire Department. Thanks again, Christy. And today we will hear about the work that Karl and Liam are collaborating on to bring additional masks to our community. Take it away, Karl.
Okay, can everyone hear me? I hope so. I'm going to back up. In February, when the pandemic in Wuhan was at a crisis, Liam Lee's company, Himalaya Capital, through its charitable foundation, the Lilu Humanitarian Foundation, began to provide assistance to the doctors and the critical care units in Wuhan in China. Through that early work, some very important relationships were established with the doctors and the people on the ground when this pandemic began. On March 10th, I received a call from Liam asking if I could assist, and our firm could assist, in organizing a conference call between the doctors in Shanghai and Wuhan who had been on the front lines in the fight against the pandemic in China, and doctors here in the United States. We reached out through some of my partners in the healthcare practice, and on March 13th, there was a conference call, a Zoom call. More than 300 medical practitioners in the United States, including representatives of the CDC, and including former majority leader Bill Frist, who is part of HCA Group. They all participated in an hour-and-a-half conference call with the doctors in Wuhan and Shanghai, providing best practices on how to deal with this pandemic. That ended up, that video, which is available and online, and we can make it available, went viral all over the country and has been very, very important in providing our medical practitioners in the United States with firsthand knowledge on how to deal with this crisis. Fast forward about 2 weeks ago, Liam and I again spoke because of their contacts, Himalaya's contacts in China. They began working with BYD, which is the largest manufacturer of masks in the world, and an initial order of 250,000 masks was made through the governor's office. Former Governor Chris Gregoire was involved, and a bunch of others. And last Friday, on April 3rd, 250,000 masks were provided to the state of Washington for redistribution to the hospitals around the state. There is an order now for 9 million additional masks that Liam Lee and his colleagues at Himalaya have organized that will be delivered to the state of Washington over the next several weeks. 5 million of them are the R95 masks, and 4 million are surgical masks. Obviously, the first priority will be to go to all of the medical institutions throughout the state and the medical care providers who are providing the first line defense. There are actually an order nationwide of 200 million masks that have been organized by Liam and his colleagues at Himalaya. They managed to get FEMA to go to BYD to make sure that BYD was producing the material to meet FEMA's standards. As a consequence, 1 million masks a week are going to FEMA through the contacts that they have at BYD. In any event, what has been most rewarding is to see our colleagues, Chinese Americans, stepping up to the plate in a time of need, using their contacts in their mainland China to bring that type of equipment to the United States. I'll turn it over to Liam for any additional remarks, but he and his colleagues are true heroes in this fight against COVID-19.
Thank you. Thank you, Karl. Can everyone hear me? Hello? If you can hear me, can you give me a thumb? Karl, can you hear me?
We can hear you.
Good. Okay. Perfect. As Karl said, this is a collective effort, and we would like to say that this we're in this together in this pandemic, and the only way we can get out of it is staying together. Is people from everywhere, from all different groups in the U.S., in the whole world. And I still remember when this pandemic happened in Wuhan, China. I was rushed to our lunch meeting trying to talk to Kim. Kim, if you remember, I tried to want to say a few words at the time. I know that we ran out of time. I wasn't able to, but I guess that's probably the starting point that our company and Ms. Lee's foundation start working on this. And after February 10th, when a whistleblower doctor, Dr. Li Wenliang, died, and so we established another charitable foundation called the Guardians of the Angels Foundation. Basically, our goal is to help the doctors, nurses, and first responders, and those angels who can help to save lives of ours, regular people. Since then, we have donated about $1.5 million worth of materials to China hospitals and preparing for them with cash and also the personal protective equipment. Due to the effort done there, we have gotten known a lot of facts that we've directly heard firsthand from the doctors, nurses on the ground. And that truth, that fact really scared us. And I mean, unfortunately, in the US, we're just not aware of how deadly or infectious this COVID-19 is. And after that, so we decided to share those facts, those words directly from the first line doctors to our medical professionals here, to warn the people here that what should be done, how can we do it, and how bad the situation really is. And with help from friends like Karl and Perkins Coie, we assembled many top doctors in the US, and from many hundreds of hospitals actually, from ours, UW, Swedish, Providence, and in the country, Harvard, Yale, all the medical centers associated with them. Here also, the Cancer Alliance Society, the Fred Hatch, all top doctors from everywhere, SAU chiefs, and to make them aware that how to fight this COVID-19 and what should we do. And after that meeting, video was broadcasted, even through Bill Frist AirPod, Second Opinion. We had a lot of calls and also requests, and especially in terms of the medical supplies and PPEs. So we raised about $5 million, primarily from private high net worth individuals, and use our connections with our invested company, BYD, and to start import their masks, surgical, and then later become KN95, and pretty soon will be N95. Those are the standards. BYD made high quality masks that really meet the standard, but because of the time it will take to finish FDA and CDC inspections, they have to just call a different name to fit in the European standards. However, they are good quality masks. So we ordered about over 1 million right now, over 1 million surgical level 3 masks, and 200,000 KN95s. And then we also get from N95s from other few factories that produce FDA approved, FDA and NASH CDC approved regular masks. and move them to import them to here, distribute them to the hospitals in Washington, and mostly in New York and Boston areas, the hot spots that really can save people's lives immediately. With this effort, we also inspired, I guess, the state's government trying to order the masks directly from a factory like BYD, because they are the ones who have the real money. Washington, we have $200 million put in place to expanding the ICUs, buying equipment, ventilators, and including masks and other PPEs. So now, not only Washington, who's the first to order from them, then the state of Illinois, Massachusetts, Texas, and New York, and even California, that was the latest. You might heard from the Governor Newsom that California state is ordering 200 million masks every month from a consorted association, I guess, in his words, but primarily that's BYD masks. And so including federal level, FEMA ordering 1 million every week. And there are efforts that put together to prepare the US for the fight of COVID-19. So I can see that in this effort, people are really working together now and to get things done, no matter what high-level politics, whatever they say. And we are in this together. The only way we can get out is staying together, help each other, and help other people is indeed helping ourselves. And that's it.
Liam, thank you so much. I don't know if you noticed, but in the chat box, there are plenty of people who are just sending their gratitude to you and to Karl. This is a tremendous success, this collaboration, working together, as you're saying, staying together. We are very, very grateful for your success and very proud to be associated.
Oh, thank you.
So
thank you very much. Thank you very much. That's just our own, everyone, including our members' success. And our life will be saved.